Coronary artery aneurysm in Tocilizumab-treated children with Kawasaki disease. Definition: Kawasaki disease is the most common systemic vasculitis in children. Coronary artery aneurysm may develop in 25% of untreated patients. Kawasaki disease is characterized by a cytokine storm with elevated levels of tumor necrosis factor (TNF), interleukin-6, granulocyte colony stimulating factor, interleukin-1, and interleukin-17. Subtopic 1.
Kawasaki disease isn't at all related to the motorcycle and engine company, other than the fact that they were both founded or first described in Japan. Kawasaki disease is a vasculitis, or an inflammation of the blood vessels, that mostly affects the coronary arteries, but can also affect any large or medium-sized arteries as well. With Kawasaki disease, the immune system attacks the arteries. Ultimately, it's not quite known why this happens, though. Some theories suggest it has some infectious cause, though autoimmune reactions and genetic predisposition probably play a part as well. Whatever the case, when the endothelial cells in the blood vessels are attacked, they become damaged, which exposes the underlying collagen and tissue factor found in the middle layer of the blood vessel, or the tunica media. And this leads to a few serious problems. First, these exposed materials increase the chance of blood coagulation. When blood coagulates, it forms clots that can block blood flow in the coronary arteries, leading to ischemia of the heart muscle. Secondly, damaged endothelial cells in the coronary arteries means weak artery walls, which can lead to coronary aneurysms. These aneurysms form because fibrin is deposited in the blood vessel wall as part of the healing process. Fibrin makes the vessels stiffer, less elastic, and unable to gently stretch with high arterial pressures. Instead, the arteries develop permanent bulges that we call aneurysms. Aneurysms 8 millimeters or larger are at the most risk of rupturing, which reduces blood flow to the heart, causing ischemia and potentially myocardial infarction, or heart attack. And third, in some cases the fibrosis doesn't lead to aneurysms, but instead the fibrosis of the blood vessel walls makes the vessel walls thicker, which reduces the lumen diameter and restricts blood flow. If blood flow is restricted or reduced, the heart again might become ischemic, leading to heart attack. Kawasaki disease is most commonly seen in infants and children under 5 years old, and is more likely to affect boys. This disease is self-limited, which means that the inflammation will resolve after 6 to 8 weeks, but if we left it untreated, there's a 20 to 25% risk of the heart complications we went over. We rarely see any cardiac symptoms in the first few weeks, unless the patient has an underlying heart condition already, and so cardiac symptoms typically evolve later. Now, the classic symptoms of Kawasaki disease are as follows: conjunctivitis with limbus sparing, which is red eyes with a margin right around the iris that's still white, a rash that might extend across other parts of the body and starts polymorphous but later desquamates or flakes off, adenopathy or enlarged lymph nodes, especially the cervical lymph nodes, a strawberry
Okay, so this young girl here is, how old is she? 2 years old, and she's here for a direct admission in the hospital for possible Kawasaki disease. And so we're going to actually, Mom has agreed to let us just do a real fast video here, just to kind of try and capture the essence of the disease. How long has she been sick?
About 6 days.
6 days? Okay. Now, she has had some positive strep cultures, you said, but she's just not eating, and you've noticed that her mouth is, she's got cracked and bleeding lips, is that right?
Yes.
And she's had a fever how many days now?
6.5 days.
6.5 days. And then you've also noted on her hands, is it just on her hands then?
It's on her hands and her feet.
Okay. I'm going to actually ask, would you guys move her out into the light a little bit so we can Yeah, this is good. This is good. Okay. Hi, sweetie. And I'm just going to I'm going to try and capture her lips a little bit here. And then let's turn her hands over. And we can do 8. Okay. Now let's see the other hand.
Applications in medicine. In a trial involving children with Kawasaki disease, infliximab, an anti-TNF antibody, along with IVEG, was found to reduce the theta score for the internal diameter of the coronary artery. Doctors conducted a prospective pilot study of tocilizumab, an anti-interleukin-6 receptor monoclonal antibody for IVEG-resistant Kawasaki disease and was approved by the Institutional Review Board of the Oklahoma City University Graduate School of Medicine on January 26, 2007.
The coronary arteries are the blood vessels that supply oxygen to the heart muscle. Because the heart muscle is always contracting, it needs a steady flow of blood to bring it nutrition and oxygen. When children develop Kawasaki disease, the walls of these arteries become inflamed. If we could go inside the blood vessels, we might see something like this. Normally, a cell layer called the endothelium protects the vessel wall and prevents blood cells from leaving.
Pros and cons. Cytokine blockade therapies may be candidate for a new way to treat Kawasaki disease. Tocilizumab may accelerate the formation of coronary artery aneurysm. Interleukin-6 plays an important role in tissue regeneration. Tocilizumab can inhibit vascular endothelial growth factor. Tocilizumab may be associated with the formation of new-onset coronary artery aneurysm.
Giant cell arteritis is a disease that has had huge unmet need ever since cortisone was invented 67 years ago. And the only medication that we had to treat patients with giant cell arteritis are glucocorticoids, prednisone. Prednisone is associated with a host of terrible side effects, although it's an effective medication in treating the disease. And these side effects make it very difficult to maintain patients on prednisone for a long period of time. So the goal of GIACTA was to demonstrate that tocilizumab has a powerful steroid-sparing effect in the disease. In order to test that hypothesis, we performed a trial that had 4 arms. There were 251 total patients.
Issue applied in Ecuador. Disease is most common among children, occasionally complicated by coronary artery occlusion. Case fatality rates 1–4% are reported.
We actually have an expert in Kawasaki disease with us, Dr. Wilbert Mason, who's from Children's Hospital, Los Angeles. And Dr. Mason, this is one of those things where, as a doctor, you need to be on the lookout for it because it's a puzzle. All these different symptoms, when seen together, we have to think about Kawasaki disease, but most parents just haven't heard of it. So what should parents be looking for?
Well, Kawasaki disease can have a lot of very visual findings associated with it. We saw many of them: the red eyes, the red lips and mouth, the rash that is very dramatic, the peeling of the skin, which occurs more later in the disease. But unfortunately, they don't all necessarily happen at the same time. They can be sequential, which is why taking pictures of it can be very, very helpful and really enabled us to make a diagnosis very rapidly.
I think one of the big symptoms, there's the rashes and the eyes and everything, but the fever that lasts for 5 days. I think most pediatricians, if you tell your doctor you have a fever, the next question should be, how long has it been? And if I hear 5 days, you start thinking Kawasaki.
So you
Conclusion. Tocilizumab may be associated with the formation of new-onset coronary artery aneurysm. Tocilizumab.
A breakthrough therapy. Next. Tocilizumab receives breakthrough designation for giant cell arteritis. The FDA granted the designation of breakthrough therapy to Tocilizumab Actemra for treating giant cell arteritis. This autoimmune disease causes inflammation of arteries, both medium and large in size, predominantly in the head.